As much of the country focused on the Mueller report on Monday, the Justice Department rocked the healthcare world with a legal filing on Obamacare in Louisiana. In a simple one-page letter, the Trump administration essentially asked the Fifth Circuit to invalidate the entire Affordable Care Act. Now, just a short time ago, the president spoke to reporters at the Capitol and was asked about the challenge. Here's what he said.
Let me just tell you exactly what my message is. The Republican Party will soon be known as the party of healthcare. You watch.
But the administration's basis for challenging the law is a December ruling by a Texas judge that the law's individual mandate couldn't be sustained in the face of changes to the tax law after the 2017 Republican tax cut bill, and ruled the remainder of the Affordable Care Act as void. Let me take a look at the Affordable Care Act and just who uses it before we get into this a little more. Government numbers show that about 9.2 million people signed up for health insurance through the federal marketplace. Now, this doesn't include the 3 million other enrollees who signed up on state-based exchanges not backed by the federal government. For now, we're just going to look at these 9.2 million people. Adults 26 to 44 and 45 to 64 make up the overwhelming majority. About 80% of those enrolled in 2018. They're majority white, making up about 50% of enrollees. The next biggest groups are Hispanic and African American at 12% and 7% each. And most enrollees live outside of rural areas, according to the Centers for Medicare and Medicaid. This next part is particularly important. A full 88% of enrollees make 1 to 4 times the federal poverty level. That's $48,560 for an individual. So they make somewhere between 1 and 4 times that amount. All of the government data giving us a look at the average healthcare marketplace enrollee. As a white man or woman, the split there about 46 to 54%, between 55 and 64 years old. They live in non-rural areas and make about $18,210 individually. Here's a distribution of the enrollees on both state and federal exchanges by state, something the president may want to consider in the administration's challenge to the law. 6 of the 9 states with the highest enrollment levels are states that he won in 2016, including the crucial Florida, Pennsylvania, and Michigan. Let's go to Kentucky, though. Joining me now is Kentucky Attorney General Andy Beshear. We want to note for full transparency that you are running for governor of your state, but right now you're just going to focus on the effects of the Affordable Care Act on Kentucky. Your state's numbers show Medicaid expansion under the Affordable Care Act covered about 500,000 residents of Kentucky. So now what happens to all those people if the Trump administration wins in this court fight to people in Kentucky?
Well, we can't let them win in this court fight. This is life or death for my people. Before we had expanded Medicaid, before we had the Affordable Care Act, we had almost 500,000 people who had never had coverage at any point in their life. This coverage is helping us to get healthier. It's helping people to live longer. It's helping to bring our communities together. And it's not just the fact that they're covered, it's how they're covered. It's the mandates for covering pre-existing conditions. It's ending the discrimination that would allow people to charge women and seniors more. It's closing that donut hole that seniors were previously paying a couple $1,000s more in prescription drugs. It's allowing kids to stay on their parents' insurance up to 26 when they're already facing such crushing student debt. It's no lifetime caps, so people with debilitating diseases aren't told I'm sorry after a few years. In a state like Kentucky that faces so many health challenges, this act, the Affordable Care Act, was truly a way to address one of our major strategic weaknesses. And I'm going to fight as hard as I can to keep that law in place, but more importantly, to keep that coverage for my people in place.
Talk to me about what, I don't know if you heard it, the president 15 minutes ago came out and said the Republican Party is going to be the party of health care. He also tweeted that. What do you make of that?
Well, I find it highly concerning that the Department of Justice would first switch positions, but then would put such important and popular issues like mandatory coverage for pre-existing conditions at issue. In Kentucky, nearly 1.8 million people have pre-existing conditions, and I'll tell you, 3 out of 4 members of my family have pre-existing conditions. These aren't just things like diabetes and lung cancer. It's everything from arthritis to acne. It would allow a healthcare company to kick anybody off virtually any time they want, and it would allow them to discriminate against women, especially in issues of pregnancy. We can't allow that to happen. I believe health health care is a basic human right. And I tell you what, if the federal government's not going to protect it, I'm going to do everything I can, and states should do everything they can. We just put out a policy today that would enshrine the most important parts of the Affordable Care Act into state law. Let's go ahead in Kentucky and protect coverage for pre-existing conditions. Let's make sure there is never that type of discrimination against women and seniors.
What can you do about it, sir? Here's the question. What if this goes the wrong way? And it might. The Fifth Circuit is the most conservative of the courts. The federal government, in a weird way, the Department of Justice is now has joined a state fight against federal government policy. That's highly unusual that would happen. But what happens if it works? What can you actually do? You say you're going to fight it, but is there a fight to be had?
Well, first, let me reassure both Kentuckians and the people of America that I believe we will win this fight. The attorney generals that have come together believe that our arguments will win the day and that the underlying ruling is simply flawed in so many different ways. And we're going to fight like heck in court to make sure the ruling's overturned. But we can, through state law, ensure that so many areas that are within the Affordable Care Act that are so critical are still available for our people. If under state law I say that any form of insurance has to cover people with pre-existing conditions, then we can still take care of our people. If we outlaw discrimination, charging women and seniors more under state law, then I can still protect our people. If we require that any insurance or coverage include kids up to 26 on their parents' insurance, then we can still look out for our young Kentuckians as they are going into the workforce. So while I am fighting as hard as I can, I don't want to leave the health of my people to the whims of the Department of Justice, which is changing positions, or to a Texas judge, or to anything coming out of D.C. This is life and death to my people, and I'm going to fight for them.
Yeah, they have changed positions. It is interesting. Thank you, sir. Andy Beshear is the Kentucky Attorney General. I want to bring in Michael Spera, Chair of the Health Policy and Management at Columbia University's Mailman School of Public Health. Michael, the Attorney General says it's health care should be a basic human right. In most of the developed world, it's been acknowledged, regardless of whether you think it's a basic human right, universality of health care has been established to be a more efficient, a more cost-effective thing, which is why conservatives and liberals in most of these countries support it.
Nearly every wealthy country in the world, except us, ensures that all of their citizens have access to a basic minimum set of health care services. Right. We don't. The ACA has brought us close to that. We're getting closer, but now at risk with the new litigation, so on and so forth, and now at risk with the effort to repeal and replace the ACA, which I thought we were done with in 2017. Right. Now that's all at risk again.
So for a lay person who doesn't follow this is a little bit complicated. The federal government has been, a lot of state governments are trying to get rid of the ACA. The Department of Justice, though it has a policy, the ACA's government policy, is doing something very unusual in joining this fight with a number of Republican state governors to knock down the whole law. Right. What happens then? If it gets knocked down, where do we go? What do people who are on ACA, what happens to them?
Well, if the Fifth Circuit upholds the Texas District Court case, and if the Supreme Court, which I have to say I don't think is going to happen. I mean, as the Attorney General said, there is extremely flawed reasoning here. The notion that the decision by Congress in the tax law to repeal the penalty for the individual mandate thereby means that the entire ACA should fall, when Congress itself specifically allowed the rest of the ACA to stand, seems to be absurd. So I think what you're saying, number one, there's a legal issue here and there's a political issue here. The legal issue is, well, what happens if you know, somehow or other the Fifth Circuit and the United States Supreme Court say no good? Then we are back to a situation where we were 2009, 2008, where we have 30 more million uninsured.
And just remind people about that, Michael, because for all the people who complain about all the things that are worthy of complaint about the Affordable Care Act, it's no perfect piece of legislation.
Right.
I want to remind people that back before then, if you were unemployed or you were privately employed or employed in a way that isn't like a major corporation, you were in the gig economy, you were a freelancer, you were a contractor, like so many people are, and you had a pre-existing condition,
you were out of luck.
There was no insurance that you could afford to buy.
There was no guarantee. If you had a pre-existing condition and you were a self-employed electrician, you were out of luck because the cost of health insurance for you in the individual market would simply be astronomical. The ACA changed that. The ACA said, you know what, you can now get affordable coverage through the exchanges,
which covered basic certain things. So there's an argument that said, well, you could get coverage, but it didn't get you what you needed. The fact is the ACA had as part of it certain basic coverages. of essential, what they called essential health benefits.
Absolutely right. It said that everybody is entitled to these basic health benefits. Now, we're in a situation now where, and where that's at risk. Again, that's at risk. And there's an irony here, too, in that, last year when the Texas case started, the Justice Department intervened in the case, surprisingly with the states, but they said, you know what? They said, if we win, all that we should get rid of the insurance regulations. All that we should get rid of is insurance regulations. Would have been terrible, but that's what they said. Now we're in a situation where a year into the case, as it's going to the Fifth Circuit, just a few weeks after we have or a couple of months after we have a new Attorney General, now the Justice Department is changing its mind and saying, you know what, we actually agree, because the individual mandate penalty has been repealed, we think the whole ACA should be repealed. I find that extraordinary. I find it unfortunate. And as you said, if we find ourselves in a situation where the ACA is repealed, we're back in a situation.
I just want to remind people what a horrible
back in a situation where millions will be really at risk.
I think it is fair for people to say the Affordable Care Act did not address everything that needed to be addressed in the healthcare system, and long way to go, but we were in a bad place.
And listen, right now we also have a political debate going on. This is part of a political debate, and we've got three different views in this political debate right now. On the one hand, you have progressive Democrats, on the left, Bernie Sanders et al., basically saying, you know what, instead of being on the defensive, we should try to get rid of the private health insurance system in the United States. We should expand Medicare, and we should have Medicare cover for all. The odds of that happening, I think, are slim. That said, you've got the middle-of-the-road, progressive, sort of middle-of-the-road moderate Democrats, Nancy Pelosi and others, who just this afternoon are saying, you know what, don't tar us with that sort of, progressive Medicare for all. We have a series of basic reforms that we think will shore up the ACA, will protect people from surprise bills, et cetera. So that's sort of strategy or approach number two. And then you've got the Republicans and the Trump administration right now, on the one hand saying we're going to be the party of health care, as the president just said, but on the other hand saying let's get rid of the ACA and who knows what, replace it with the, really unbelievable.
Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.